Allison Greenwood. I'm one of the neurology PAs here at Health Partners at St. Paul, and I work with people who suffered from strokes, and I work closely with Gwen as well.
Yeah. So, and I'm Gwen Kosevich, nurse practitioner, as I said, from the Neuroscience Center. I'm a stroke specialist and a TBI specialist. I actually see more patients with concussion than stroke, but brain bleed is a form of stroke as well too. So yeah, we have this combined clinic at the Neuroscience Center where if a patient has needs with neurology and physical medicine, we see them both together on the same day.
Yeah, and then Lynn, you can just do the next slide. You would like? There you go. So Gwen and I work together. We do this combined clinic here at the clinic where I see patients who have recently suffered from a stroke and kind of talk about, I guess we'll do the next slide, but we talk about their stroke and what happened and secondary prevention. And then Gwen kind of fills in and does more of the rehab conversation. So the people that we see are typically people that just came out of the hospital or just came out of the acute rehab setting, and they need their first time follow-up in the outpatient setting. So Len, you can do the next slide. So the goals in my clinic, and you, again, it sounds like some of you guys have, suffered a stroke years prior, so you may remember some of this, and I won't go over this too much, but essentially the goal with my clinic is that we kind of review your medications to make sure you're on the correct medications for stroke prevention. A lot of this stroke information is more for people who've suffered what's called an ischemic stroke or a low blood flow stroke. But we look at, again, medications. Are you on the correct medication, such as aspirin, a cholesterol medication, blood pressure medication, diabetes medication, and if we need to start anything. I always like to go over my images with my patients as well too, just to show you where your stroke is, what that could have impacted, what are the symptoms of the type of stroke that you had. So I like to make sure you go through images and get a good understanding of what happened and what type of stroke it is. And again, go through your lab markers of, what were some things that could have been increased risk for stroke. And then again, I like to kind of close the loop of making sure that we have all the appropriate workup for why you had a stroke and how to prevent a stroke in the future. So that involves heart monitoring, looking at your heart a little bit closer with that echocardiogram. In some cases, we do a little bit more intense imaging where we look inside your brain through a catheter. We don't need to get into that, but I'd make sure that we have a good understanding or at least somewhat of idea of why you had the stroke and to prevent another stroke, essentially. And then the big thing I like to talk about is sometimes we don't know why you had the stroke, and that can be frustrating and that can be kind of hard, but a lot of times we don't know the reason why. But now let's move on to how can we prevent another stroke. So what's that secondary prevention?
The blue one? Yeah, the one I have here.
We can get into that a little bit more too on my next slide, but then again, I touch base a little bit on what can happen related to a stroke, so consequences of a stroke, more long-term effects. And then briefly, I touch base on if you need any referrals, like surgical referrals or anything, or sleep medicine referral if you might have sleep apnea, other things that could cause risk for recurrent strokes if you have some underlying condition. So we'll get a little bit more at the next slide, Lynn. So I'm a physician assistant, but I started as a dietitian. So I do like to speak a little bit of lifestyle changes and nutrition, and that's typically a topic that people like to talk about quite a bit in my office. But just in general, around 90% of strokes can be preventable, and that's related to these modifiable risk factors. So some things that we can modify are listed over here. So things that we can control: the smoking, high blood pressure, high cholesterol, diabetes, sedentary lifestyle, obesity. Sleep apnea is a big one. That's an independent stroke risk factor, so I really harp on sleep apnea. But these are things that I know they're hard. Just to say to quit smoking isn't an easy thing, but these are things that we can work to control, that we can better improve to help prevent future strokes. And then there are some things we just can't control. As we get older, we have higher risk of stroke. Females are a higher risk of stroke versus males. Family history, race. So those are some things we can't control. So I obviously focus on these modifiable risk factors and making small goals that we can try to make improvements essentially to prevent those prevent a second stroke. Okay, next slide. So this is the dietitian in me speaking. Again, I like to talk a little nutrition. In my office, I have these fun little, this is gonna be hard to appreciate on video, but I have my little food models. You can't see this very well, but these are my little tubes of salt. So I talk about how much salt is in food. We go through.
I didn't know this.
These are kind of fun. They're again better in person, but there's these little food models, and I tell you how much salt is in certain foods. But in general, big things again. So these lifestyle changes. There was a study that showed people at the age who ate really healthy. They're 50 years old who ate very healthy, a Mediterranean type diet, nearly 90% lower risk of dementia, and compared to those who'd had less healthy diets. And these diets were based upon people who followed a Mediterranean diet and a DASH diet. You've probably been told to follow that Mediterranean diet, but there's a lot of research backing that type of diet actually. So the Mediterranean diet, there's about a 20% to 25% lower risk, lower stroke risk if you can follow that type of eating. The emphasis of it, things that we know, it's just hard to do, but the emphasis of this Mediterranean diet is the majority of your fat comes from olive oils. So it's going to be thinking of fats that are liquid at room temperature. Those fats that are solid at room temperature are not necessarily as good of fats for you. So olive oil is the main source of fat. High intake of fish. Generally, it's actually most of your diet of protein should be from fish and less from meat, essentially. Fruits, veggies, nuts, legumes, and then less consumption of like red meats, essentially, and dairy. The DASH diet, again, is a similar type of diet. It stands for Dietary Approaches to Stop Hypertension. This is pretty similar to the Mediterranean diet. The difference is that it lets you have a little bit more meat and dairy. They're both really good ways of eating. I have some more little fat. I have some other little things here that I always show my patients. And again, it's just showing leaner fats, lower fat items. So it's hard to see, but this is my little tube of fat and this is whole milk here. Yeah, okay. This is whole milk. And this is skim milk. And the white is the fat. So you can see there's a big difference.
Yeah.
We talk about like lower fat foods. That's another fun one to show you. So here's our fish. This is a good one. So the white is fish. And then here is ground beef.
What percent?
90%.
90%?
Yeah. Yeah. Here's a good one. Here's a cheeseburger. I don't mean to ruin this food for you, but let's see, let's do another one. Here's a hot dog. This is a hot dog. This is my chicken breast. And then this is again fish. So this is why Mediterranean diet says, aim for fish. It's a little bit leaner and high protein and leaner. Yeah, these are kind of fun to have in the clinic.
Yeah, I like that.
Let's see. I guess I should slow down. Do you guys have any questions specifically about this Mediterranean diet, DASH diet, anything that I've talked about so far? And no pressure.
You're doing great. Keep it up.
Love it. Thanks for the encouragement.
I'm sure
I love the visual aids.
Good. Yeah, these are a hit, I tell you.
Yeah,
So,
that's really cool. I haven't even seen that before, so I appreciate that as well. Yeah, so I'm sure that some of you remember going through all those things with the neurologist, but some of you was longer ago, so it's some of it's just a blur, I bet.
Yeah. Let's see. You can go ahead and do the next slide. I think I just have a couple more. So this is another thing that I bring up with my patients that I talk about, again, focusing more on nutrition. We've gone away from that food pyramid. So now what we're doing is we're doing more a healthy plate. So a way of thinking about how to eat healthy in the simplest way to think about this is half your plate being a vegetable. As you can see, half this plate is a vegetable. I think of maybe 2 fistfuls of your vegetable, 1 fist of a grain, 1 fist of a protein. So that's the visualization rather than that food pyramid that you may have been taught years ago. This is a better representation of how to eat healthy. it's hard to do this every single meal, but if you're aiming for, you know, at least one meal a day like this, that's improvement maybe for some. So this is kind of what I focus on here. And this is an example of a Mediterranean style of eating. Yeah. Yeah, thank you. And then another thing that I touch on too that is important just to remember when you're, when you're healing from a stroke and just the long-term effects of a stroke, coming away a little bit more from nutrition and just talk about more of these stroke complications. So some things that I feel like don't get addressed often that maybe should more often is post-stroke depression. Super common, about 30% of stroke survivors suffer from depression. I think this isn't addressed very often, like I said. So if it's something that you've ever been feeling, I highly recommend talking to your primary provider about this because we can help with this. There are resources here. The other one that I get really commonly is post-stroke fatigue. This really varies from who experiences this, and there can be multiple reasons why. There's no one great treatment for it, but no, it's common. People feel this way. There can be multiple reasons. So really it actually is, I know this sounds hard to do, but it actually is promoting physical activity, promoting getting out, getting exercise. That actually really helps with that fatigue. I know it sounds really hard to do it if you're feeling that way, but it is super important actually to fight that fatigue is to get out. And then other things that can be complicating factors to it is if you do suffer from depression, anxiety, chronic pain, sleep disturbances, which you can get sleep disturbances after a stroke. And then avoiding medications that can make you more sleepy. And alcohol is not good for brain healing and brain health. So those can all interfere with that. And then finally, I have to do my plug for sleep disorders. Sleep apnea, as I mentioned earlier, is an independent stroke risk factor. I often have people who come into the clinic who I'm pretty suspicious that they could have a sleep disorder such as sleep apnea. And I highly encourage to do the sleep study. Nobody wants to do the sleep study, but if we can treat your sleep apnea, that is one more thing that we can do to help prevent another stroke. So my point there is if someone recommends to do the sleep study, do the sleep study, please.
I second that.
Yeah. So that's a big one. I feel like people think they sleep okay, but really that actually is that's a big one. So all in all, that's just my little tidbit, but I'll have Gwen go, and then if you guys have questions afterwards, we can kind of go through stuff.
Or if they have questions now.
Yeah, either.
Any questions so far? That was a lot of information, even though you didn't think it was. It was good, really good information. Any questions?
It's very good presentation.
Yes, it was. Definitely.
Good. Thanks, guys.
Thank you. Yes. All right. So I'm Gwen. I'm a nurse practitioner. I've been working in the rehab area since 1995. So in different aspects of rehab. So I worked in the hospital and now I work in the outpatient clinic. And so sometimes patients don't understand the role of a physiatrist. So a physiatrist is someone, either a doctor, PA, or a nurse practitioner that works with patients with different neurological disorders. And our focus is on function. So we help in the stroke arena, we help people with strokes to function better. So it's just an easy way of saying it. So I'm not a physical therapist, but we work really closely with all the therapies to help people after stroke. Oh, then you can just go to the next. Yeah. So how can we help you? I know neurology does a lot of things. In your appointment, you do a great job covering all of the imaging and the treatments and the recommendations and everything. But after stroke, there can be, as you have all experienced, I'm sure, there can be many issues that have changed with your function. Next slide. Okay, so this is an example patient based on a real patient that I had. And her fake name is Rita Z. She was a 51-year-old school bus driver. After her stroke, she had a number of issues with speech, thinking, and function. And she had left-sided weakness, speech changes, and cognitive issues. She had a lot of different symptoms. And then she also had emotional changes such as depression. So due to her stroke, she was a bus driver, and then she wasn't able to work as a bus driver anymore. So then we had to look at that. Yeah, we had to change, she had to change her job duties. She still worked for the school, but she just couldn't drive bus anymore because of the regulations. And then she was fearful of having another stroke. So I worked with her along, I've seen her since 2016, actually, not very often now, but worked with her with all of her therapies and kind of worked with even vocational rehab type things, worked on all the different things that she needed with the therapies, kind of worked and followed up with her and followed her through it to get her through it. And she found it helpful. And we talked about, we had to do a driver's evaluation and we got her back to driving. And then she was slowly back to work. And then we, as the last thing, we worked with her diet quite a bit and with exercise, a lot of counseling with that, getting her to be able to do that. And then she is back to work full time. So she's doing really well. So it was just helpful for her to have someone to follow up with all those things that were going on after her stroke.
What's she doing for work now?
She works at the school, helping with a para with the students.
Cool.
So
Very
she still
cool.
gets to work with the kids, and she's just a wonderful lady. So, and it's in physical medicine and in a lot of different areas of medicine, it's nice to be able to get to know a patient and follow them for many years. And, that's rewarding and helpful to be able to get to know them and just to see how their progress is really exciting to me, even after this many years of being in physical medicine. I love it. So then looking at the whole person and improving function, depending on your stroke and how it affects you, deficit wise, I look at that. What are their deficits? What are they having trouble with? We can connect you with work related concerns. Sometimes I do all the paperwork involved with short-term disability and all these FMLAs and things like that, getting you back to work safely. We do driver's evaluations at the Neuroscience Center, and we can connect you more with the Minnesota Stroke Association if you weren't already. I am involved with the Minnesota Stroke Association. They have strides for stroke and they have a walk every year. I've done some things with them and it's been nice to get out in the community. And then we can assist with something called spasticity, which isn't super common in the patients that I see, but with stroke, it is pretty common. So spasticity is a special condition, and all the physical medicine people here assist with that condition if people have that. So, okay. And I guess that's all. That went by too fast. So as you know, if you know anyone or if you need anybody that in physical medicine to help you, there's a phone number here, 651-495-6400. There's a phone number, and can they see this present? Can they see the slides of two? They can see the number there, Lynn? Okay. And then also with neurology, there's also a number there too if you have any neurology needs, okay? Or if you know anyone else that does.